First of all, my name is Tiffany Music. I am a senior public health specialist at the Missouri Department of Health and Senior Services. We are going to about a lot of different things. So we'll go on. Today we're going to talk about the things you see on screen. So as you can see, we will cover all aspects of community health workers, or as you will hear me refer to them as CHWs. We're going to start with the definition of a community health worker, their roles and responsibilities, CHW training in Missouri, the CHW Association of Missouri, credentialing, and then we'll end with several examples of how Missouri CHWs are making a difference. The Missouri Department of Health and Senior Services, along with most of the United States, has chosen to use the American Public Health Association's definition for community health workers. That definition states that a community health worker is a frontline public health worker who is a trusted member of and/or has an unusually close understanding of the community served. This trusting relationship enables the worker to serve as a liaison, link, or an intermediary between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. A community health worker also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. Community health worker is actually an umbrella term, and it includes roles like community health representative, promotores, peers, and other workforce members who are frontline public health professionals that share life experience, trust, compassion, cultural, and value alignment with the communities where they live and serve. I've listed a few of the many titles that fall under the community health worker umbrella. So we've got patient navigator, community health representative, promotores, public health aide, community outreach worker, peer support specialists, and lay health advisors. Those are just a few of the more than 60 different roles that kind of fall under this umbrella. Oh. Sorry. We are going to see if this will work. I've got a short video here. It was created by the Kansas City CHW Coalition and Mid-America Regional Council, and it really gives a great just a great overview of CHWs in general. So tell me if you can not hear sound. Okay, I think I've got it.
Our health is influenced by many things, like healthy food, secure housing, or access to healthcare. Those without adequate housing or employment, or who struggle financially, often have worse health outcomes. Community health workers provide critical support to those in underserved communities.
Community health workers are a key part of the healthcare system or the healthcare team. They work with members at the one-to-one level, and what they do is support them by assessing and addressing their social economic needs.
One of the taglines for community health workers is they are of and from the communities they serve. And that is so important.
Community healthcare workers are those frontline, boots on the ground folks who get in with the community and the people that they work.
Somebody who puts their heart and to put their passion just to make sure that others are getting what they need.
Community health workers are trained health professionals who help connect residents in underserved communities to resources. By helping clients obtain resources such as utility and rent assistance, healthy food, medications, transportation to medical appointments, their health status is often improved. Community health workers bridge language and cultural barriers to help clients communicate with care teams and follow through with their care plans.
Most of the time, community health workers have something very special, which is that they understand they have been in the community they serve. So they're able to relate with those that they're working with. What we have been advocating for is to bring that one-to-one level of care, to bring that connection between individuals and that trust that has been lost for many years.
And our goal is to really bridge those gaps where families are encountering barriers to accessing health services. So our community health worker spends a lot of time listening to the family first to understand what they need. And then from there, they begin to build, I think, a level of trust that allows them to help that family.
They are the ambassadors of health. They just have a good understanding of the medical system, the social system, and also the clients in the community. So that's what, to me, a community health worker is.
Most community health workers are lay people in the community. We just are connectors. It's always good to have a peer, someone who's been there, who knows your community, your language, so to speak, whether it's literal language or, figuratively, where we're from.
Both Kansas and Missouri have established CHW certification programs, and in the Kansas City area, more than 20 organizations work with CHWs to improve the lives of their clients. CHWs work across the whole system, from hospital emergency departments to community organizations that provide social supports.
Do you want all families of all children to be able to access healthcare services in a timely manner and in a way that prevents problems from happening? And if you can answer yes to that, then you really want more community health workers.
There is a lot of evidence, research, and at the local level and at a national level, at a global level, that the role of community health workers is very important. They can have great impact on health outcomes because they are taking care of those socioeconomic factors or addressing those socioeconomic factors that clinical providers or the clinical team are not able to address on a clinical setting.
Community health workers can often get to some of the root causes of our illnesses that are, beyond the surface. Because we build those trusted relationships, we can find out a little bit more about what's going on at home.
When a client is struggling with their needs, sometimes they are overwhelmed. They feel like they fell through the cracks through the system and no one is helping. So when a community health worker is working with clients, they just get together in the client's house, right? So you are safe, you're in your own spot, you're in your own place. And it is that relatability that makes the client feel comfortable and they open up.
Community health workers are very much naturally, culturally competent. They are culturally humble. And they use those skills to advocate and protect the individuals that they work with. And also, I think it brings a lot of value for the provider. They are actually making sure that what the provider is saying, either in the same language or in another language, is being understood. So when the client or the patient leaves that office, the community health worker, the patient, and the physician are in the same page that is understood what is expected from the member.
At the end of the day, it's not just the CSW who has to do all this. The CSW is the person that can open or lead the client to the door, but the client is the one that needs to open that door and just making sure that they follow through with the plan and everything. So,
community health workers are in the right place at the right time in clients' homes and neighborhoods to help people self-manage their health conditions and improve their health outcomes. CHW's work complements and supports the work of physicians, nurses, and social workers.
The favorite part of my job is just connecting with people. Love to see the aha moments. Love to see, people's like, I did it. I'm doing this. Yes, you did, and yes, you can.
We are just making sure that all the clients are becoming more self-sufficient. So that is going to help now and in the future, because if you train people on how to do those things on their own, that's magic. That is going to make sure that people is not struggling in the future. We might struggle with resources, but they will know how to get there when the resources are there.
It's an emerging role, and it's an exciting time to be talking about it, because I think it may be new to you, but it will undoubtedly become a familiar term, I think, over the next 5 to 10 years for a lot of people. I hope so. If it was up to me, we would be inserting them everywhere, in schools, in clinics, in churches, not just in emergency rooms and acute care settings, but we really need our community health workers everywhere we are. So,
Community health workers bridge gaps in our healthcare systems, providing better health outcomes for our family, friends, and neighbors.
One of the things that I think we're very slowly shifting is to the understanding that we have been paying for to fix things that are already broken. And we have done very little as a healthcare system to work in prevention and management. So if we know that and we can intervene early on time, we will be saving millions of dollars to the healthcare system. And we can do that by investing on a workforce that can do a lot of that work. And we are not there yet, but I think we will be there soon. Yeah.
All right, now that we have kind of defined the community health workers, we're going to discuss social determinants of health and how they relate to the community health workers' roles and responsibilities. It's important to understand what social determinants of health are so that we can understand why community health workers are so valuable. According to Healthy People 2030, social determinants of health, or SDOH, are the conditions in the environment where people are born, live, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. It is important to ensure that patients' social determinants of health are met first, because if they're not, the patient will have a difficult time achieving their health goals or social services tasks or goals. One example that I always use is if you do not know where your next meal is coming from, taking your blood pressure 3 or 4 times a day, like your doctor recommended, is not going to be the priority, right? Like it's not going to matter to you. You don't have the capacity to worry about blood pressure when you don't know if you can eat or not. And that's just one of many examples. Social determinants of health can be grouped into 5 domains as shown on screen: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context are the 5 domains. Social determinants of health can have a major impact on people's health, well-being, and quality of life. So examples of social determinants of health include safe housing, transportation, and neighborhoods, racism, discrimination and violence, education, job opportunities and income, access to nutritious food and physical activity opportunities, polluted air and water, and language and literacy skills. Social determinants of health also contribute to wide health disparities and inequities. For example, people who don't have access to grocery stores with healthy food are going to be much less likely to have good nutrition. That raises their risk of health conditions like heart disease, diabetes, and obesity, and even lowers life expectancy relative to people who do have access to healthy foods. Now that we have a little better understanding of how the role of a community health worker is defined and what social determinants of health are and how they could affect someone's overall health, let's take a look at the role of a community health worker. Community health workers truly have a wide variety of duties. They recognize gaps and advocate for individuals and community health needs. They assist in coordinating care by linking people to appropriate information and services. CHWs also provide culturally appropriate health education to individuals, organizations, and/or communities in an effort to reduce modifiable risk factors and encourage healthy behaviors. They also serve as a culturally informed liaison between individuals and community healthcare systems. And perhaps most importantly, they provide encouragement and social support to assist individuals with goal setting and barrier identification within those professional boundaries. CHWs assist clients in their homes, communities, or clinical settings. They communicate to their clients the purpose of the program and the impact it may have on their well-being. They help their patients identify socioeconomic issues that affect their overall health and develop health and social management plans and goals. CHWs also coach their patients in effective management of their chronic health conditions and self-care. They assist their patients in understanding care plans and instructions. CHWs educate their clients on things such as the proper use of emergency room and provide information for alternative care sites. They motivate their patients to be active and engaged participants in their own health and overall well-being. CHWs also document all client encounters. They complete and submit reports as required by their employer, maintain comprehensive electronic client files, including client notes, release of information, assessments, and other medical documents acquired on behalf of the client. CHWs facilitate communication and coordinate services between providers and the patient. They coordinate and monitor services, including tracking of the client's compliance in relation to care plan objectives. They also provide support and advocacy during initial medical visits or when necessary to assure the client's needs and the referrals required are being conveyed. They also follow up with both clients and providers regarding health and social services plans. The CHWs do not only work in the health field. As I mentioned earlier, CHW is an umbrella role, and the community health worker workforce is on the rise nationally. Many different types of agencies have discovered that community health workers are often the key to reaching people who are left out in traditional healthcare and services. Community health workers are employed in many different types of organizations. In Missouri alone, CHWs work in hospitals, medical clinic, outpatient care centers, schools, religious organizations, nonprofits, and even pharmacy. In fact, in Missouri, some of our partners have developed a few unique programs for CHWs. There are over 150 pharmacy technicians in Missouri that have been formally trained as community health workers. And we'll discuss this particular training program later, but it's important to note that this training is for pharmacy staff and created by pharmacy staff. Missouri also has several doulas that are cross-trained as CHWs, and these cross-training opportunities just provide the client with even better care. The reality is that CHWs anywhere have a similar role to link people with health and social services to improve the quality of care, but they work in many settings. They work wherever they live, including rural areas, urban areas, and major metropolitan hubs. Missouri has developed a comprehensive training for community health workers based around the CHW core competencies. Missouri has a state-approved curriculum based on currently based on Foundations for Community Health Workers, and the current curriculum is based on the second edition. We are actively preparing the curriculum and updating to the third edition. The third edition is the greenish color that is shown on screen there. It was just released in May, so we are working rapidly to get our curriculum updated to match the new textbook. But all certified curriculum providers in Missouri and Kansas use the state-approved curriculum. While it is not required in the state of Missouri to take the CHW course, the curriculum used by the certified curriculum providers is the only recognized curriculum for CHWs in the state of Missouri. CHWs are, of course, welcome to take the CHW course from other organizations, but they will not be eligible for credentialing if they do, and we will talk about that a little more in just a few minutes. I mentioned the CHW core competencies that our curriculum is based on. Missouri CHWs are trained and expected to meet and understand the core competencies that are listed on screen. These core competencies guide the training CHWs complete in Missouri and Kansas. And we'll just run through them real quick. Of course, professionalism and conduct includes how to handle ethical challenges facing the individual and community served, individual confidentiality and privacy rights, balancing care for patients and self-care, how to act decisively in complex situations, but also taking full advantage of professional collaboration and supervision support when needed. And finally, the importance of observing organizational rules and applicable laws and regulations governing public and private resources, while exercising creativity and helping community members meet their individual and family needs. Self-awareness is pretty self-explanatory. However, it is really important. CHWs need to be able to understand the importance of being aware of one's own emotional and behavioral responses to individuals and community members and manage their personal feelings productively in order to maintain effectiveness as a CHW. The service coordination and system navigation for individuals and families means that CHWs assist licensed healthcare providers in the coordination of care. They help people understand and use the services of health providers and other service organizations. They help address practical problems that may interfere with the ability to follow the provider's instructions and advice, helping to bridge cultural, linguistic, knowledge and literacy differences, and understanding and sharing information about available resources and support to improve health services. Education for healthy behavior change means providing people with information, tools, and encouragement to help them improve their health and stay healthy over time, while also respecting people's experience and their ability to learn, take advantage of resources, and set priorities for changing their own behavior. Advocacy, again, is pretty self-explanatory, but it is working with or on behalf of people to exercise their rights and gain access to resources. It also involves supporting individuals in the community by bringing awareness to issues impacting health. Individual and community capacity building goes hand in hand with advocacy. It is encouraging individuals to identify and prioritize their personal, family, and community needs. It's also encouraging individuals to identify and use available resources to meet their needs and goals, and providing information and support for people to advocate for themselves over time and to participate in the provision of improved services. It is also building and maintaining networks and collaborating with appropriate community partners in capacity building activities. Effective communication, I'm not going to define that for you. Just know it's a mix of listening, speaking, gathering, and sharing information, resolving conflict, and checking for understanding. It's all of the things that are important to communication. CHWs are meant to be cultural mediators by improving services and reducing disparities. Identity may be based on race, ethnicity, language, religion, sex, gender identity, sexual orientation, disability, health condition, education, income, place, profession, history, or other factors. Culture also includes organizational cultures, which are reflected in how organizations deliver services. The CHWs encourage and help enable individuals to participate in decisions that affect their lives, their families, and their communities. Documentation and reporting, again, I'm not going to go over that. That is self-explanatory. The use of public and community health concepts and approaches just means public health and community health is evidence-based discipline that focuses on protecting and promoting population health, preventing illness and injury, eliminating health inequalities, and working to improve the health of vulnerable communities and populations. CHWs understand that individual health is shaped by family, community, and the wider social determinants of health. And then individual assessment is an ongoing process that, when combined with regular evaluation of progress, helps assure effective individual and community-centered care. Individual assessment is the gathering of information from direct communication with individuals to understand, identify, and address the individual's goals for optimal health. CHWs facilitate health improvement planning with individuals and consult with the healthcare team to agree upon a plan as appropriate. And then community assessment is doing the same. It's identifying barriers and resources within the community. A community assessment is often necessary for both advocacy and capacity building to occur. So CHWs are trained on all of those, and they are trained at a certified curriculum provider. DHSS does have a training program certification. It was designed to expand the number of sites and organizations offering the high quality education to CHWs, while also ensuring that all CHWs that take the course have the same training, whether they take the course in the far northwest corner of Missouri or St. Louis or Southeast or anywhere in between. All of our curriculum providers are required to complete semi-annual reports as well as pre and post course surveys so that DHSS can kind of keep an eye on what's going on statewide. In addition to having to apply to be a certified curriculum provider, all instructors and co-instructors for the CHW course are required to take the Train the Trainer course, because CHWs are not your traditional college student. We do offer it 2 to 3 times a year, and it was just offered in July of 2024. There is a Community Health Worker Association of Missouri. They are often called SHWAM. It is a collective of people throughout the state of Missouri working to improve health outcomes for a diverse population. This association brings members from across the state together to share ideas, raise awareness, and support each other in the journey towards public health. SHWAM has a vision that is put together through advocacy, educational opportunities, professional development, community resources, employment resources, and networking opportunities. There are many reasons that CHWs choose to join SHWAM. The top 10 reasons are the connection, the annual conference, public policy and advocacy, free informational services, networking, affiliation, discounts for educational offerings, leadership opportunities, recognition, and empowerment. We do have an opportunity in Missouri for CHWs to become credentialed. In order to become a credentialed CHW or CHWC, an individual must have a minimum of a high school diploma or equivalent. They must also have completed a CHW certificate program as one of the approved curriculum providers that we previously discussed. Each year, DHSS then sends the Missouri Credentialing Board an updated list of approved curriculum providers. The application to become a credentialed CHW is found on the Missouri Credentialing Board website. The application itself is pretty straightforward. They have to provide documentation showing that, like I said, they've completed high school or a high school equivalency program and the CHW certificate course at a certified curriculum provider. In addition to that, they must complete the application that's online and sign the code of ethics. A CHW must also agree to a background check and complete the Family Care Safety Registry Worker registration form, and send all of this in with the $75 application fee. And then once that is processed and approved, the CHW is credentialed for around 2 years. just as with most occupations in the health field, the CHWs do have a code of ethics and are responsible for maintaining that, making sure that their behavior meets the code of ethics. Once a CHW is credentialed, they are required to complete 20 hours of continuing education every 2 years. 6 of those ethics have to be ethic, or 6 of those hours have to be ethics, sorry. Each community health worker is expected to keep track of their own CEUs. They keep their certificates, and when it is time to be re-credentialed, the community health worker is required to send in proof of their ethics course being completed. And then if they are randomly audited, they also have to show proof of the other 14 hours of training. If they're not audited, they have to complete an attestation form, just saying that they've completed the training. And then of course, the Missouri Credentialing Board can audit at any time. So it is important for community health workers to always maintain proof of their training. Community health workers are making a huge difference in their clients' lives day in and day out. I hear so many stories about how a community health worker has changed the entire trajectory of someone's life. DHSS received funding under an enhanced laboratory capacity grant to be used toward the mitigation of COVID-19. We began implementing the Community Health Worker Initiative in 2021, and the funding will continue through July of 26. Through this funding, we have reached 70 counties in Missouri. 64,448 clients have been assessed for underlying health conditions. There are 123 CHWs employed through this funding, with 29 being at community-based organizations, 60 at federally qualified health centers, and 34 at local public health agencies. In addition, there are 23 supervisors at FQHCs and 6 at LPHAs. There have also been 450 pharmacy technicians trained as CHWs. These CHWs have been quite busy referring clients to social determinants of health resources. 1,578 resources have been made through LPHAs, 976 at community-based organizations, and a whopping 28,796 referrals towards social determinants of health resources have been made at federally qualified health centers. Organizational partnerships have also formed as a result of the great work CHWs are doing in their communities, and health fairs have also been held. Perhaps the most important success that stems from this initiative is the recognition and respect that CHWs are now, they have now earned in their communities. There are so many great success stories for CHWs all over Missouri, but I would like to leave you with these. Betty Jean Kerr, People's Health Center CHW, stated, "One of our frequent flyers at the Metro Market came for a blood pressure reading and looked sad. I performed an assessment and he stated that he was feeling really down and depressed. I called him the next day to check on him, which made his day, and as he stated that no one else ever calls him. He continued to explain that he was depressed because he had been displaced last year from his apartment where everything was in walking distance. Now he can only shop at our facility when the Metro Market bus is present. Although a great asset, the options are much more limited compared to a grocery store, and he has to carry whatever he buys home. This was also an issue because he does not have a buggy, but just a cart to carry his food. To assist, I did the following things. I was able to get him a buggy. I then provided him with resources for local grocery stores within walking distance of his new residence. I talked with the patient about his depression and what he felt was needed to assist. To handle his depression, along with making him feel better, I invited him to participate in our patient focus group. Therefore, he can give us feedback on the services needed to better serve the community and meet like-minded people. I plan on following up with him after our next meeting. This is just an example. The CHW was able to make a connection with this client and will therefore be better able to assess and address the social determinants of health moving forward. Another one says, a supervisor from Freeman Health shared, a second grader with autism was able to receive a weighted blanket, which has been very helpful to the child. The CHW called several organizations and churches to see if any of them offered these blankets as donations. She was successful in finding a group of ladies from a church that made the blanket for the second grader. Both the mother and child were very pleased to receive the blanket. CHW is being aware of and having connection at a variety of community organizations made this possible. And finally, a supervisor from Family and Community Together in Marion shared, here is an account of how my work as a CHW underscores strength of community support. A resilient mother caring for her 2 children reached out for assistance in securing clothing and shoes. As I found out more about her situation, I discovered that she was currently without a stable source of income. I quickly connected her to a selection of local thrift stores known for their benevolence. These establishments, with their commendable commitment to community welfare, graciously provided the family with essential clothing. In a gratifying turn of events, the mother, touched by the generosity she received, shared her heartfelt appreciation. She conveyed not only her ability to obtain the necessary clothing for her children, but also the profound impact of the information we facilitated. The heartening success story echoes the transformative influence of collective support and underscores the significance of extending a helping hand to those in need. A woman expressed her gratitude for our ability to connect her to a much needed free fresh produce box that aided her during a challenging period in her life. After spending 3 weeks in the hospital due to an infection, she is slowly recovering, but still unable to resume her work responsibilities. On top of that, she's caring for 2 children whose mother was incarcerated at that time. The provision of this food served as a lifeline, bridging the gap until she can fully recover and return to work. So Missouri CHWs are doing all kinds of things. They impress me every day. I know I've thrown a lot of information your way, but does anyone have any questions for me?
We've got a question here.
Okay.
How much does it cost for people to get certified and like do all the coursework and
So it's a certificate course. And when I think the prices are still pretty similar. When we received that money through the ELC grant to deploy CHWs, I had to kind of go through and figure out how much everyone was charging statewide. And of our 16 curriculum providers, I think that it averages, including the book and fees and everything, it's about $1,600 to $1,700 per person. It takes about 12 to 16 weeks to complete the course. It's 100 hours of class time and then 60 hours of service learning. A lot of times employers will pay for that class, and a lot of the curriculum providers actually have grant funding to offer the course and textbook and everything for free.
So I was curious, do you have an advanced course of sorts, or an accelerated version for someone that maybe had done this in a separate state and gotten previous training in this to kind of just catch them up? Or would someone have to go through the entire program?
At this time, we just have the one course. Missouri and Kansas offer reciprocity, and we actually use the same curriculum. However, at least for now, we don't offer any type of reciprocity for other states, so they would have to take the whole class if they want to be credentialed. Now, there is no requirement to take the class. We highly, highly recommend it because we believe that those core competencies are really important. But at this time, there's no requirement to take the course or be credentialed. I think eventually we will have a state plan amendment passed that will allow CHWs to bill Medicaid. And I think eventually when that happens, CHWs will likely have to be credentialed in order to bill Medicaid. But that won't prevent them from working in the field if they don't need to bill Medicaid, if that makes sense. Any other questions?
I don't think we have any more questions here.
All right. Well, my contact information is on screen. Please feel free to reach out to me anytime. Happy to help you with connecting with community health workers in your area, the CHW Association resources, or anything else.
Thank you so much.
Thank
Thank you.